Hello and welcome. We're going to give just a couple seconds here as people are joining. All right. Good afternoon, good morning, or good evening, wherever you are joining us from. My name is Caroline Adams, and it is my pleasure to welcome you to the GSA webinar, Aging in a Place, Perspectives on the Meanings of Home and Community from Age-Focused Researchers and Practitioners, brought to you by the GSA Humanities, Arts, and Cultural Gerontology Advisory Panel. If you would like to know more about the advisory panel, please visit the link that I just posted in the chat. So we have a few housekeeping items to go through, but first, please introduce yourself in the chat. We would love to know who's here. Our program is being recorded today and will be archived on the GSA website. Please feel free to submit questions using the Q&A feature at any time during the program. A question and answer session will immediately follow the live presentations, and we invite you to use that feature to engage with our panelists. All right, so now it is my honor to introduce you to today's panelists, starting with Andrew Clark. Andrew Clark is a professor in the School of Health and Society at the University of Salford, where he teaches on the sociology, criminology, and social policy degree programs. Andrew is particularly interested in three areas: neighborhoods and communities, dementia, and innovation and creativity in social science research methods. Central to his work is a commitment to interdisciplinary activity and the benefits this can bring to understanding real-world problems and issues. Our second panelist is Bailey Hu, who is an urban planner and a research assistant at the Joint Center for Housing Studies at Harvard University, where she works on projects that seek to expand the range of affordable, safe, and accessible housing options for older adults. She's especially interested in how policy gets translated into practice at the community level. She is a co-author of the forthcoming report, Advancing Housing and Health Equity for Older Adults, Pandemic Innovations and Policy Ideas, to be released on October 6th by the Joint Center for Housing Studies and the Hastings Center. Chris Reeder-Young is our third panelist and is an applied anthropologist and director of research and policy at the Habitat for Humanity of Greater Memphis. She specializes in asset-based, community-driven research and evaluating programming at the intersection of health and housing. Since 2009, Young has led all research and evaluations focusing on neighborhood revitalization, affordable homeownership, and critical adaptive home interventions as social determinants of health and community well-being. And finally, our panel moderator is Nancy Berlinger, who is a research scholar at the Hastings Center, an independent bioethics research institute based in Garrison, New York. She oversees interdisciplinary research on ethical and practical challenges arising from population aging, with special attention to dementia, to housing and community, and to the role of cultural and policy narratives in conveying values and obligations concerning older adults. With Jennifer Malinsky at the Joint Center for Housing Studies, she is co-hosting a public webinar series this fall that will feature lessons from housing providers, the age-friendly movement, and age-focused policymakers on how to translate innovations from the COVID COVID moment into needed social change. So without further delay, I will pass the microphone over to Nancy.
Thank you so much, Caroline. I'm so excited to be here with these panelists and to have the opportunity to come together to talk about some of my favorite topics at the intersection of humanities research and applied gerontology, with many other voices and disciplines in the picture. I want to give a shout out to the advisory panel that is sponsoring this along with the environmental gerontology work group. I joined the panel fairly recently, and one of the first things they suggest is that you put a panel together. So this was, one of my volunteer activities, and it's really been a pleasure to work with our colleagues to put this together. So what we're going to do is each of the panelists is going to give a brief presentation about their own work, touching on these themes as they see fit. And then we're going to come back and we're going to see if we have any questions for each other. I'm going to post some questions, and then we're going to take your questions. So if you have questions as people are presenting, please just put them in the Q&A. We'll see them. We'll get to them. No worries. And we'll all be available after we close the webinar. You can follow up with any of us by email, of course. So without further ado, I'd like to invite Bailey to give us the first presentation.
Thanks, Nancy. I'll go ahead and share my screen. All right. So today thank you, Caroline, for introducing us. Just to give a little bit more background, I've worked as a research assistant at the Joint Center for Housing Studies for over a year, focusing on topics related to housing and older adults. And before that, I got my degree at Tufts, and I was also a fellow at the City of Boston's Department of Neighborhood Development. So before I came to the Joint Center, my previous work and research wasn't really focused on older adults. So today I'm going to talk more about the work that my colleagues and I have been doing as part of the Housing and Aging Society program. So in case you're not familiar, the Joint Center for Housing Studies is a research center housed at Harvard. Our goal is to conduct social science research that informs policymakers. And we have multiple areas of focus that include housing markets, issues that are specific to homeowners, issues that are specific to renters, and also demographic and neighborhood change. So there's also been work being done on housing for older adults. And in March of this year, we launched a new program called the Housing and Aging Society program, which kind of formalizes the work that was already being done and also kind of opens up some new directions for our research. So on this slide, I have the mission statement for the Housing and Aging Society program. As you can see, it says we aim to advance policy, planning, design, and public health solutions to address the housing needs of older adults. And public health in particular is kind of a new direction for us. So we're excited to see where this brings us. To be a little bit more specific about what our research actually looks like, these are some of the themes that we cover. Similar to the rest of the Joint Center, one of our major concerns is housing affordability and the lack of housing options for people in the US, which affects people of all ages. Some of our recent work specifically looks at how housing affordability affects health and well-being for older adults and safety of the home. Housing accessibility is a major topic of our research, and also homes are, of course, situated within neighborhoods as well. So we also look at how neighborhoods can be more inclusive, accessible, and offer connections to different resources, as I think Andrew is going to get more into in his presentation. And then finally, we also are really interested in looking at housing that provides or allows for services to be delivered on site, including healthcare services and also other forms of care, as this can help people stay in the residential setting of their choice for longer. And here are a few examples of the things that we're about to release or have produced over the last few years. These projects have been done together with members of our core research team at the Housing and Aging Society program, also with other members of the Joint Center of Housing Studies, and people from outside the center, such as Nancy, for instance. So if you look at the report cover on the leftmost here, this is our new report, which is coming out on October 6th. And this is kind of an exciting development for us for a number of reasons. First of all, we got to work with a network of professionals in the fields of housing, aging, and public health. We got to interview also other experts from around the country, such as Chris. And this is this is kind of new territory for us to cover. This report was based on a qualitative scan of pandemic policies and practices that we conducted last year. So these practices are all connected to housing or services in the home in some way, and we're hoping they're going to be useful for policymakers, for housing and service providers, grant makers, and we'll be talking more about that in the series of webinars that Nancy and John Linsky will be hosting. If you move to the right of that, our previous work kind of draws on similar themes as well. There was this cover on the second from the left is based on examining accessibility of housing stock in the US and how well it corresponds to older adults' needs. So this analysis found a very large need for more accessible housing that accommodates people's needs in the US. If you look at the paper in the middle, this looked at older homeowners who are still making payments on their mortgages and found that they may be cutting back their spending on out-of-pocket pharmaceuticals. So there may be a trade-off between health and housing costs happening there. To the right of that is a survey of service coordinators in public subsidized housing. So these are trained staff members who work inside often affordable housing complexes, and they deal directly with older adults and other residents. And this survey found that during the pandemic, service coordinators played a really big role in ensuring older adults' safety and well-being. And then finally, on the rightmost report here is looking at the Livability Index, which is published by AARP every year. So this rates communities based on their housing, their transportation, the quality of their air and water, and other factors. So this report looks specifically at where exactly the most livable communities are located within the US, and also who exactly has access to the resources that are offered there. So this is just kind of a sampling of some of the work that we're really excited about. And if you'd like to learn more, they're all available to read on the Joint Center website. So without further ado, I'm going to pass it on to Chris, I think.
Yeah, thank you so much, Bailey. I'm going to go ahead. Okay, can everyone see my screen? So today I'll share a little bit about how and why Memphis Habitat adopted an Aging in Place program, which offers free critical repairs and accessibility modifications to some of the most limited in income individuals in our area. And of course, I'll build off of what Bailey shared, because so much of their center's work has driven the way that we have shaped programming, that I've blended much of this by honoring the cultural practices that really inform success for one day to hopefully make more informed policy, which is what we all want. I always say that if we're lucky that we age, if we're extra lucky that we age in our home, and if we are extra lucky, we get to age with our home. So Memphis Habitat believes in a place where everyone has a decent place to live. We are global, and habitats everywhere, working in diverse systems where the goal is really to make shelter possible for everyone. And that can be because they are affected by a problematic housing policy or civil war, natural disaster. It doesn't matter where we're working with the cultural perceptions of that group to inform shelter and humanity. But in our little corner of the world, we've built over 570 homes in the last 40 years. And this zero interest loan that we provide stimulates significant social determinants of health for home buyers and their families and their communities. I have a partnership with Harvard's Joint Center for Housing Studies, and they've helped to kind of blend the qualitative work that I'm gathering here in Memphis with their aggregated data and their data-driven reports. We know that by 2038, about a third of households in the US will be headed by someone 65 and older. So the face of America is about to change big time. And our infrastructure and human service policy and programs really need to start preparing for that. Winter is coming, and we already know that these demographic changes will probably show some significant disparities for lower income adults. So in 2011, we saw the need for assisting older adults in Memphis, and this is where most of my evaluation work is now. We've been working with different kinds of programs across the state and locally, different strategic partnerships, and then we've been awarded multi-million-dollar projects to stimulate aging in place program that we kind of hope other habitats around the globe will also pick up in addition to their new home buyer programming. Anthropology, which is kind of the heart of what I do, has been almost entirely based on regarding what older adults have to say about different types of social phenomenon. And so that has always been my practice. So the basis of good anthropological research and evaluation has been one of reciprocity with the communities where we're working. And we know that older adult housing, stability, quality, affordability, and then their connection to the neighborhood will not only impact their health outcomes, but the healthcare systems that support them and take care of them. When I look at the impact of our programming, I lean into theories and gerontological support that says we're not here to extract your cultural experiences and ethnographic experiences for the purpose of writing a giant white paper. We're here for it to provide better programming and to influence policy and healthcare system outcome changes. In the past couple of years, we've been doing critical home repairs like roof repairs, floor repairs, accessibility modifications that are ADA compliant, such as toilets, grab bars, and ramps on the outside of the home. We know that older adults are important cultural assets to the city, and that includes, vulnerable age groups, and proactive programming is really valuable. They pay taxes, they're eyes on the street, they provide intergenerational support to grandchildren, and just making sure that we're serving them appropriately is very significant for us. We know that slips and falls can end up in the emergency department, high utilization of those systems, and sometimes it's scary to say, but sometimes one slip can mean that you're in long-term care services or nursing homes. And believe me, from the thousands of folks I've spoken with across Tennessee, that is not what they want. So early in the research, when I was starting to determine what exactly was going on in the homes that residents felt were most significant for us to take care of, I essentially developed a system that was connected to healthy homes research related to construction. I asked them, in what ways was their home aging in a way that was not adaptive and helpful for them? What scared them about their home? And so I created sort of this theory of change that helped me develop a survey tool, and then also to inform the construction modifications that we started to implement. So I could start to deduce which interventions could improve conditions the most for clients. I could see what saved the most money for them, for healthcare systems, or how we needed to move the better policy in and around where we are. So the boxes in red sort of identify large categories of impact, and then those underneath kind of show how it's affecting that human. So if a client shares with me that their roof is leaking, it's caving in, there's rain and cold air coming in, that can impact their respiratory health. Maybe pests and insects are coming in. Maybe their utilities are really high and they don't have enough money for food or medication because they're on a fixed income and they're doing their best to keep their utilities and lights on. There's been lots of times where residents have shared with me that they have sequestered away from social opportunity because they're embarrassed about their homes, so their grandkids aren't coming over. By repairing one roof for $13,000, we can address the client's respiratory health, their socialization, and we can remove that variable that is causing high utilities. We're helping them stay in their home, which is the most important thing. And then while we're there, we're adding grab bars, accessibility modifications that help them prevent falls and other slips and things like that. So we're defining the cultural concepts of home and safety so that we can provide exactly what they need. I know that this is a lot to read through, but through the thousands of sentences of qualitative data that I was collecting, I essentially created sort of these pockets and categories of impact. And many of them fell into some of the same ones: safety, savings, food security, falls, that through construction activity that we can make a huge difference for individuals who are aging in place. And so this helps me have conversations with members of Congress as they are shifting to approve federal dollars that come down to state levels. And it's the same thing with safety concepts. I have conversations with foundations, with even individual donors to our program, that helping an individual with bathroom activities can make a huge difference for their ability to remain in that home. I wanted to provide a little bit of show and tell. On the far left, there's before and after right underneath one another. You can see a handrail to the right-hand side of the stairs. The next image from top to down is a toileting situation that that individual had accommodated as best as they could. But you can see that the flooring, the toileting, the hygiene opportunities and grab bars really make a big difference for that individual, and that separates between a fall and a secure bathing experience. Once we get into a lot of homes, we see that the roof isn't just the shingles on top, it's certainly what's going on underneath. And we found on a number of occasions, individuals did not have plumbing access, so they were using other rooms in their home as plumbing opportunities. What I try to explain to those who have never experienced any type of housing conditions that affected their health negatively is that it's important to gather each individual person's story about what's going on in their home. In addition to the human factors through anthropology, I work with economists to kind of turn these qualitative measurements into data for those more numbers heavy palettes. Each year, we find that about 33 aging in place clients say that they would have gone to a nursing home full time within a year if it had not been for those repairs and modifications. They said that falling, inability to clean their bodies, poor electrical, and utility costs was putting them on a very scary trajectory. When they report that they're probably going to go to a nursing home, I know it's really bad because nobody wants to go to a nursing home. I find a lot of times that churches and families don't have the capacity to make the appropriate repairs. So many of them don't have any other place to go. So it meant that they may end up homeless. So what we're finding is that the average cost of a semi-private room in Tennessee is about $85,000 a year. So if 33 individuals are being deferred from that, we're saving the state of Tennessee about $2.8 million a year. And we are looking at a 3.3 return on investment for every dollar that we spend in Memphis. So it's not just serving those individuals and their families, but it's also serving the community at large. I always like to say that home is also where the savings are, right? We mentioned that individuals on fixed income, if they have high utilities, they might choose heating their home over eating in their home. And that's a very difficult thing that we can see broadly in gerontological studies as well. There's cultural relevance with humans and their relationship to income and spending. And again, I've worked with the economists to look at sort of long-term and tertiary savings or even costs that's blended with that qualitative data to make sure that the sides of the research coin is both qualitative and quantitative for those who are looking at our work from different perspectives. I like to say that we've saved about $0.8 million for energy cost savings for one of the most energy cost burden individuals in the United States. And that makes a huge difference for how we're able to advocate on public policy as well. We know that if all of these individuals were to go into a nursing home or to become homeless, that not only would it affect them and their families, but it would also cost a great deal in neighborhood appreciation values. We're looking at vacancy, we're looking at blight. When a vacant and blighted property exists, it costs a great deal for government, code enforcement, police, law enforcement, fire department. So we're looking at these significant community opportunities. Plus, it's wonderful because so many individuals continue to participate in civic activities in their neighborhoods and they want to stay connected. So I'll close on this, a quote from Ruth Benedict: "The purpose of anthropology is to make the world safe for human differences. And even though aging might be universal, and we're lucky if we get there, we have to know that we should work together safely and successfully so that we can provide equitable opportunities for all." So I'm going to close out of this, and then I will share with Andrew. You have the floor.
Thanks, everybody. So hopefully you are seeing my slides. Are you able to see my slides?
Yes, looks great.
Perfect, thank you. Okay, so thanks for that. Thanks for inviting me to speak today. I'm going to talk for 10 minutes about a research project that I was fortunate to be involved in that was exploring the neighborhood experiences of people living with dementia. This was a project that was funded by the Economic and Social Research Council and the National Institute for Health Research in the United Kingdom. It was a project that was exploring what neighborhoods mean for people living with dementia. I've spent the last 10 years exploring issues of aging in place using creative and innovative research methods, but this was a project that focused particularly on individuals who had a diagnosis of dementia. I usually say at this point that doesn't mean that aging and dementia are synonymous. We know that many people will age without developing dementia, and there are also a number of people who have a diagnosis of dementia who may not classify themselves as an older person. But nonetheless, I think that there are perhaps some parallels and some issues that emerge through this research that perhaps resonate and also raise questions about what it means to age in place, regardless of whether somebody has a diagnosis of dementia. But as I say, we were really interested in the meaning of neighborhoods for people living in 3 locations, in Sweden, in Scotland, and in England. The project was overseen by myself and my colleague Richard Ward, who's based at the University of Stirling in Scotland. And we devised a range of what we call qualitatively driven or participative methods, including mobile and visual methods. But also what was really important to us was being able to place the views and the experiences and the voices of people living with dementia at the center of the research project as well. So with a view to that, we included 127 individuals across the 3 locations, and we asked people to take part in 3 different ways. First of all, we asked someone living with dementia or a nominated care partner to support them to produce a participatory social network map where they mapped out individuals who they knew and used that to elicit commentary on the kinds of relationships that they had. We also asked people living with dementia to take us for a walk around where they lived. With a view to that, we didn't sort of prescribe how long the walk should take. We didn't talk about where people should take them. We left it very open to people to choose where they wanted to take us. And we also asked people living with dementia to take us on a tour of their home. So we asked them to kind of act as a tour guide to show us different aspects of their home. The work was longitudinal in design, so we returned after 12 months to people to ask them to repeat the mapping exercise and also the walking exercise. I clearly can't go through all the findings of this was a 5-year study, so what I'm just going to do is just comment on a couple of issues that emerged. So first of all was the idea that, yes, there's certainly been loads of really excellent work that's been exploring neighborhoods as sort of physical or material entities or phenomena that have looked at the aspects of the different built environment. That's not just in environmental gerontology, but also in a number of dementia studies as well. But what also emerged very strongly from those people we talked to was the ways in which neighborhoods should be understood as a kind of social practice. So neighborhoods were providing an opportunity for people to keep out a sort of watchful eye on people to check that everything was okay. Now, at one level, this was about people talking about neighbours and other local figures in the neighbourhood, checking up or keeping an eye on people who were living with dementia to ensure that they were okay, and also to engage in sort of what we might call routine acts of kindness, taking parcels in, taking trash cans out and things like that, or indeed just being available in case of some sort of emergency or if local help was needed. But what also emerged really strongly is that people who lived with dementia reciprocated those kinds of practices. So they talked to us about how they too kept an eye on their neighbours. They would take parcels in for their neighbours, and that they would also engage in this two-way sort of process of looking out for people. The second thing that emerged was the importance of shallow or informal interactions, what some anthropologists might refer to as weak ties, for example, particularly with a group of individuals that we called familiar strangers. These were individuals who were perhaps recognizable even if people didn't know their names. So these might have been people who worked in a local shop or a local cafe, or quite noticeably, people who they may see roundabout on the street, or if they would go out for a walk. What we saw is that this process of maintaining a watchful eye and also keeping up with these informal or shallow interactions was very much dependent on issues of familiarity, of routine, and of habituation. So people living with dementia talked to us about how important it was for them to be able to go on a regular walk or to visit a particular shop, for example, because that gave them a sense of being able to build up this level of familiarity. And what we also found is that people talked about how that gave them a kind of sense of almost like a safety net or a sense of security, that if something was to go wrong or if they were in need of assistance, that those familiar strangers would be able to help them, in part because they recognize them from being round and about. And so what we start to see there is that there's a sense that people can feel connected to a wider social sphere. In the context of dementia, I think that's really important because there is a lot of literature around the idea that people start to experience a shrinking world where people's social and physical geographies contract as a result of a diagnosis or because of stigma, and also because of various difficulties perhaps getting out and about. Whereas this ability to engage in these familiar, routine and habitual practices with other people enabled people, so this is what they told us, to connect with that wider sphere. And you can see a couple of quotations there on the right-hand side of the screen, sort of illustrating that sort of thing. I think the one I would point to is the lower of those two quotations, with an individual who talks about how they like to spend time looking out the window, seeing passers-by come and go. And again, in terms of that sense of being connected, we found that for those individuals who as a result of the symptoms of the condition, found it harder to leave the home as a result, or for example, mobility problems, or perhaps because they needed a bit of help undertaking day-to-day tasks, then that ability to connect through a window or over a threshold really started to take on an important meaning. So what we start to see is, when we think about neighborhoods, it's really important to think about the home not as a place that is separate to a neighborhood location, but actually a part of it, and part of the ways in which people can continue to feel that sense of belonging to other people. And then the second theme that I wanted to touch upon is the idea that neighborhoods perhaps can be conceptualized not just as physical places or sort of containers within which people go about their day-to-day lives, but neighborhoods can also be seen as sort of networks that are stretched over time and space. And what I mean by that, I think, is illustrated by these two quotations here. So we can see on the left-hand side, this was an individual living with dementia who talked to us about how she would repeat a regular walk across her neighborhood that she could do on her own, but that she very rarely went to other places. What she talks about is how actually by doing this walk, she can remember how to get back home because she's been doing it for years and years. And what she actually added to this is that because she has done this walk regularly, she feels that she is recognized along this route. And if she was to experience any difficulties, people would come to her assistance and help her to return home. And then the other quotation on the right-hand side was an individual who talks about how she would regularly, this was by regular, we talk about this weekly, she would take a bus journey to her sister-in-law's house. And she talks about how she wouldn't go anywhere else on the bus, but she could make this regular journey because she knows where the bus stop is, she knows the route of the bus, and she knows where to get off. what she talks about there is that she doesn't go anywhere else on the bus, she says, but she can get to her sister-in-law's house. I can do that, no problem. I've done it for so long, it's like going to the corner of the street. And what I like about this extract is that when we think about neighborhoods, we often think about that place on the corner, those shops or those cafes or those community assets that are located within walking distance at the end of the street. And here we see an example of how for this individual, that corner of the street is actually a bus ride away. And it kind of is indicative of the ways in which neighborhoods, if we understand them as networks rather than as sort of fixed locations, can also be seen to provide that form of assistance. But of course, what this relies on is the regularity and the routine and the ability of, for example, that bus service to continue, and also for that individual to continue to have the confidence to leave the home and continue to go, in this case, to figuratively the corner of her street with her sister-in-law. So in terms of thinking about what this means for neighborhoods, so within the UK, there's a movement called the dementia-friendly communities or dementia-friendly neighborhoods movement, which is a national level movement organized through the Alzheimer's Society to support people to live independently within their neighborhoods and communities. And our research wasn't an evaluation of this dementia-friendly communities initiative, nor were we trying to assess or measure the friendliness of a neighborhood or a community. But what we can start to see from the data, first of all, is that neighborhoods really matter for people living with dementia, but that's not in the kind of romanticized or nostalgic way that perhaps communities are sometimes presented. We know that communities mean different things to different people, and that's why I think there's a real, we need to be very cautious of seeing neighborhood and community as the same thing. Second, what we see is that people living with dementia can contribute to the social life of local places. And we think that they can do this by getting involved or engaging in what we've called spontaneous acts and social interactions. It's about bumping into people on the street, but it's also about maintaining those familiar and routine interactions and journeys across the neighborhood. What we also see is that neighborhoods are very malleable. They're very fluid or flexible across time and space. We know that translocal or non-local interactions can be just as important as very local interactions. Indeed, many people talk to us about the importance of places that meant something to them that weren't perhaps ostensibly within the physical proximities of where they lived. And it's really important that we can find ways to enable people to continue to engage in those translocal interactions. But we also know that memory and biographical experiences can also give rise to different senses of what it means to belong in place. So when we return to people after 12 months, we could see that there were shifts or changes in people's symptoms of dementia, but they were nonetheless still able to maintain connections with others, even if they were perhaps slightly different than what they had been previously. And that really leads us to sort of suggest that neighborhoods are kind of produced or reproduced through what the geographer Doreen Massey talked about as articulated moments in networks of social relations and understanding. I mean, what we're really kind of trying to say there through the data and through the experiences of people who we had the privilege to hear and share with is that really neighborhoods are about connecting with other people, because it's through the ability to connect socially with other people that individuals felt that they could belong to those local places where they lived. So that's a kind of whistle-stop tour through some of the issues that we found in the research. If you want to find out more, then myself, Richard Ward, and our colleague Lynn Phillipson have an edited collection that came out at the end of last year, and there are also various publications that are available there. If you have difficulty accessing them, then drop me an email and I'm very happy to send them on to you. That's my 10 minutes up. I just want to say thank you very much for listening to me.
Well, thank you, Andrew. Thank you, Chris. Thank you, Bailey. That was magnificent. That was, I've pages of scribbling because you just sparked so many ideas and connections. But thank you for walking us through your research. And one thing I'd like to do, and please feel free to turn your cameras on so we can pretend we're all in the same room, do you have any questions for each other? Because you may not be some of your research you may know each other's work, but may not. And I just wonder whether it's a methodology question or a definitional question, or just to say, wow, I really want to do that. Feel free.
I have a question for Andrew. I found your work really fascinating. And I'm kind of curious by this, or I'm fascinated by this idea of a neighborhood as a network rather than just a set of buildings and, you know, a discrete unit. So I'm just wondering, what do you think the implications are for future research? Because a lot of research does tend to consider neighborhoods as, you know, a circle on a map.
So I think it's a really good question. And sometimes so first of all, it's about not dismissing all that work that goes into understanding neighborhoods as kind of a collection of built phenomena. That is really important. Instead, I think there's a couple of things. First of all, it's about recognizing the importance of sort of social practices and connections and relationships that can be incredibly important, particularly, you know, in the context of dementia, but also aging as well. They can be really important to enable people to belong. And second, I think it's about perhaps thinking a little bit about how the built environment can enable those connections to happen. Now, I'm not talking in a kind of deterministic kind of way, but it is about thinking about how the built environment might be able to afford opportunity for informal interactions. So the significance, and other people have made this point far more eloquently than me, but the significance of public spaces, the importance of benches, for example, that can enable people to come together. But also what we can start to see is just because you plan for or build for interaction doesn't necessarily mean that that interaction will follow, in part because we also know that public spaces or neighborhoods and streets are experienced differently by different people. So what we also started to see in the work that I didn't really comment on is that there's a sort of temporal rhythm to neighborhoods. And so we started to see that people would leave the home at particular times, or that they, or both time of the day, but also time of the year, for example. We started to see that actually in winter, if the streets aren't cleared of leaves, then that can have a real impact on people's confidence to get out and about. So I suppose that's a really, you know, it's a long-winded way of me saying that we need to understand the social and the physical together, but also we need to really understand how some of those seemingly trivial, seemingly really mundane or ordinary everyday aspects of social interactions can perhaps be accommodated for within the built environment.
Thank you, Bailey and Andrew. Anyone else? Any conversations or questions? If not, I have plenty. And of course, participants, please feel free to put your questions in the Q&A, because you're up next. I just want to mention that we have the audience for this webinar includes colleagues from Finland, Mexico, and Ireland, in addition to throughout the United States, a wider range of researchers and people working in different applied research settings. So, you know, if you have questions from your location or from your discipline, that's, you know, very, very welcome. You know, each of you, I'm just a little shout out to the humanities here, which is my background. Yeah, place is having a moment in the humanities. The National Endowment for the Humanities did a workshop on helping humanities-based scholars to use mapping technologies. I have a colleague who's a philosopher who's writing a book on the ethics of placemaking. So this is a concept that we are kind of playing around with. Some people look at things like refugee camps, places that you say, you know, this is a place that's been created, but in a suboptimal way, and so on. And I think we would agree that some of the ways development has worked, housing development, neighborhood development, suburban development has worked against the kind of density that I think Andrew was describing, the idea of being able to go down the street or take a bus route. I can remember doing some work with geriatricians in Singapore, which is a very planned place and very compact. And there was a geriatrician who said, you know, I have a patient who is able, even though he's moved, he knows the bus route back to the coffee shop that he likes to go to. And it's on his mental map, it's in the long-term memory. And as long as that bus route doesn't change, he's good. You know, he knows where he is. And it reminded me so much of what Andrew was talking about things being on your mental map that may not be on your street or inside your building, and involving people who you don't necessarily know because they're on different ends of a bus route. But I wonder how the various ideas that you've been working with in any of your projects, how might they be extended to places where there is less density, that were never built for aging in place? Although people may have lived there for a long time, they may have moved to the suburbs and, you know, wanted the rooms, and, you know, they didn't mind the stairs at an earlier stage in life. But, you know, how far do some of these concepts go, do you think? And this is really an open question to anyone.
So I can tackle kind of a corner of that. For us, we follow this concept of the curb cut effect, where if you're in a community and you remove the step up to a curb and you create a smooth surface where it's no step, a stroller, a wheelchair, a temporary person, you know, a temporary injury that you might be using a cane, or someone who is using that type of device full time, that's a universal consideration that helps all types of generations. And so we usually talk in terms of aging in place with the kind of extended benefit of that curb cut effect impacting all types of individuals who might benefit from removing that step, removing that curb, removing any kind of trip hazards, fall hazards. And it's not just for residents and, you know, members of the neighborhood, but it's for postal carriers, it's for delivery individuals. It might be for folks who are coming and touring the neighborhood, like in Memphis, we have a lot of tourist sites. And so it makes it accessible and opportunistic for a lot of folks. In terms of rural spaces, you know, when we expanded our Aging in Place program, there were a lot of individuals who were in rural areas, areas of Tennessee and the Appalachia. They had lost hospitals, libraries, schools, because that funding and that density had essentially been removed. So we were some of the only support systems available for them to help. So at that moment in time, it was really about focusing on the home and that place as their entire existence. It's where their adult children would bring grandchildren to come and visit. So we had to kind of shift our thinking from urban to rural, where it was this urban space where we work with lots of different types of strategic partners addressing curb cut effect and things like that, to rural spaces where we absolutely had to address septic systems and things where folks had ultimately been forgotten about out in the country. So we had to shift how we considered aging in place and what place meant for us so that we could help as many individuals as possible, with the outcome significantly being on social well-being and health outcomes as well. So I don't know if that answers your question as much, but we had to kind of re-envision that for ourselves.
No, that's exactly what I was interested in, is what infrastructure do you get in a more dense environment that you can't take for granted in a more rural environment, even though that may be the place that people value. Exactly. Thank you so much. Anyone else on thoughts on that?
Just very briefly, Nancy, I think it's a good question, and I got three responses really very similar to what Chris was saying. First of all, I think a focus on the home can be really helpful, particularly the home not just as bricks and mortar, but the meaning of a home, and viewing the home as a much more porous idea that enables connections to be made across the threshold. The second thing, I think that there is opportunity to support people to engage with different kinds of connections. So what we found with those individuals who were perhaps more geographically isolated in rural areas, then they were very reliant on other people to take them to groups, for example. But what we also saw was there's a realignment of where people felt they belonged, and people started to talk about a kind of almost like a dementia activism identity that meant that they started to develop new sorts of relationships with different kinds of support groups or friendship groups based around dementia. But those relationships were dependent on different kinds of support to enable people to either get to meetings or also to get online. And then the last point I would make, and it's not really an answer, I think it's more a question, is it really makes me think about how easy is it to do this kind of global research, and how easy do these ideas and these concepts reach across, not just in this case, reach across the Atlantic, but also I'm really mindful that our research is perhaps very European in its approach, but also based in part on the history of kind of urban design and neighborhood planning within the UK and also within Sweden. But it makes me think about to what extent can we apply these lessons to other parts of the world as well. I suppose my comment to that is, while the lessons might be very different, I think the methods and the techniques we use to try to understand people's life worlds are the things that perhaps we can translate to other sorts of contexts.
Well, that leads me to a lead in to the Q&A, because one thing I noticed is that you all are doing research in such innovative ways. I mean, I love that Andrew is like looking for innovative and creative ways, because that makes it interesting for the researcher too. But it also allows you to look at real world challenges that may not have been part of your training, but you're saying, well, here's a better way to do this. And I know that Chris, you trained as a medical anthropologist. This probably wasn't on career day for medical anthropology, like, what was offered to you, but, you found a place to apply your training as an anthropologist. And Bailey, your work as a journalist and in urban planning, cited you. I've worked with Bailey for some time, and the fact that she already knew her way around city government was really helpful because she knew where to look for things. And since we were looking for the kinds of ways that people communicated with each other during pandemic, what did people write to each other about what they were trying? This wasn't in the research literature yet. So that was quite innovative. And we're hoping there's a methodology section from our report that says, here's how we did this. But then you want to interview people to say, well, what actually happened? Or do you have any preliminary findings, or what didn't work? So there's a lot of back and forth about in this type of work. And there is a question here from a participant who is in Finland, who has a question for Andrew, who says, I love the creative research methods, asking people to take you for a walk and such. Were there any challenges to these methods, some of which you've already alluded to, like how to record or report the data, or other things that came up that don't come up with more traditional methods?
It's a good question, one that I could actually spend the rest of the session talking about, so I will answer really briefly. One of the challenges was actually persuading other people, perhaps at times other researchers, some of my colleagues, that people living with dementia would be interested or even able to take part in some of this research. So one of the challenges was perhaps around saying that actually we do think that it might be possible to work with people in these ways. There are challenges around ethics, not just around kind of bureaucratic processes of IRBs, institutional review boards, for example, but also some of the ethics of working with people living with dementia, asking them to take us for a walk, for example. There were some challenges, as you put in the question, around recording the data. So we tried to record as much as we could through sound recorders. With the home tours, we used a video camera, but we made sure that the technology was pretty low key, partly because we thought that lessened the risk of something going wrong, but also because we didn't want any of the equipment or the technology to replace what we wanted to do. We wanted to walk alongside people living with dementia. We wanted to understand something of their world in ways that kind of were meaningful to them. And so we didn't want to put too much emphasis on making sure we were recording everything all of the time. And instead we placed a lot of faith in some fairly generic recording devices. The maps that we produced were produced on paper with pens and highlighter pens and things like that. And so it was also as much about these activities as a form of elicitation of what, it's not so much the end product as the way in which we got to that product at the end that mattered to us. So the home tour, for example, were not all of them were amazing recordings of people showing us around their house. What mattered to us was that people understood that their home meant something, and these were the things they wanted to point out to us. But I'm very happy to offline have a longer discussion with people about some of the challenges that we faced.
Thank you, Andrew. When Chris was speaking, I was also really impressed by I wasn't surprised that people were concerned about things like bathrooms, toilets, nitty-gritty sorts of things, that questions that weren't answerable by, oh, just have grab bars or just redo your entire bathroom with all the money and construction dust that will take, and things that are just, oh, just do this as though it's simple. And so, but the fact that I found myself writing when you were talking about this, that this looked to me like dignity in action. That, you know, as part of Habitat for Humanity, you were saying these are things that really matter to people a great deal, not just health or hygiene or fall prevention, but this really mattered to people, that they were safe in the bathroom. And so I just thought that was wonderful. And that sets up nicely a question from a colleague in Ireland, I believe, Tom Gray. This is for Andrew, but also more broadly, I think. Andrew talks about the neighborhood as home as much as your house. What does this mean for supported housing or residential long-term care settings that are located within neighborhoods, but as we know, that sit in an odd place when we think about housing? They're residential care, but nobody wants to go there, as Chris talked about. And they can be off of people's mental maps. I live in New York City, and I remember during March 2020, you could picture the hospital really easily where all the ambulances were going, but there was a long-term care facility in the middle of the neighborhood, and you weren't thinking about that until you started hearing how many people were dying there. And so that's a question, like, where does that supportive housing, perhaps with people with complex medical and social needs, that maybe it's a homeless shelter, maybe it is an assisted living facility or a long-term care facility, fit into some of the concepts that we're talking about here, home, community, place? Anyone have at it?
I'm going to actually pass to Bailey and Chris, because I think they're much better placed than me to comment on.
So I can share one partnership that we have with the Green and Healthy Homes Initiative. They collect the Medicare, Medicaid data connected to our clients. So if I'm helping Ms. Jones and I provide her with an ADA compliant toilet, grab bars, and a handheld shower head in her bathroom, my friends at GHHI can look at any kind of fall data that may be associated with her now newfound stability in that bathroom. The qualitative data tells me that fall data could be anywhere in her home, but she really has a hard time in that bathroom. So I'm able to communicate with that with a statistician to paint a broader landscape of outcomes and impact. Another thing that we really focus on is making sure that we are working with as many other strategic partners as possible, because we have to think in terms of not creeping out of our mission into other geographic and other organizations' territory, but how can we be a spoke in the wheel with the client being at the center? I take a nod to the Capable program through Sarah Zanton's work at Johns Hopkins University, where the individual, the client, has an occupational therapist, a nursing focus, and then a construction person, so that if I build a ramp outside the home of Ms. Jones, but I don't have an occupational therapist work with her on how to use it, then Habitat hasn't made much of a difference. And we've been poor stewards of the money and the funding. And members of Congress are going to go, well, we're not going to give you money again. So it's important for us to look at the human being as sort of this individual that is impacted by strategic partnerships, and that it's not just a ramp, but it is, how do you use the ramp? And most importantly, where should that ramp go based on how Ms. Jones is connected to her place, to her home? If we put it in the backyard, but she goes out the front yard, well, that's not going to help her much. So we try to do our best to, again, take the people who are smarter than us in different ways and make sure it's all client-centered, so that we're not missing anything, and that my qualitative data is making the most sense.
Just to build off of what Chris said, I think the question of how we build kind of more comprehensive systems of support for people with different levels of needs and communities, it's definitely an open question, especially in the US. Because like Chris, I think of programs like Capable, I think of PACE, which is, I think, Program of All-Inclusive Care for the Elderly. And these are kind of great options for people who may have more needs or need help staying in their homes. But they don't cover a lot of places. They're still expanding. Some of them are still pilots. So in the US especially, I think we rely a lot on community-based organizations to kind of engage with people, learn about their needs, and also address those needs. So I think there's definitely a need to kind of integrate these systems more and make sure that they can address different kinds of settings.
Well, we appear to be at time. I just want to thank everyone, Andrew, Chris, and Bailey, and Caroline for hosting. This was a wonderful way to spend an hour. And so I hope you'll follow up with everyone. And if anyone has anything they want to remind us about, or say, here's if you were interested in what I was saying, here's how to follow us. I can recommend Andrew's book, the book that Andrew and colleagues were part of, Dementia and Place, is a great read. Bailey has mentioned the publications of the Joint Center for Housing Studies. I think there's a webinar link, a link to our forthcoming series of webinars that may be of interest. We're also going to be at GSA. Chris, anything you want to tell us about things that are going on in Memphis?
Well, I am a sucker for a good story, so I dropped one of our videos in the chat box so that you can visit one of our aging in place clients' home, Mr. Ernestine and Mrs. Shirley. So you can visit that video.
Fantastic. And I take it that this is a taped webinar, so it will be archived and accessible to everyone. Well, thank you so much, and I'll turn the baton back over to Caroline.
Great. Yes, I echo my thanks. I put my email address in the chat as well. If anyone has specific questions about GSA or the Humanities, Arts, and Cultural Gerontology Advisory Panel, feel free to send me an email. And I can also work as a liaison to connect you with any of our panelists or with Nancy if you have further questions. And with that, that's the end of our program. Thank you all very much and have a great day.
Well, that was terrific. Thank you. Wasn't I clever to choose the right people? Thanks so much. Interesting. Most of the questions came from outside the US. So that's great. So I guess, Carolyn, will we know who was part of this? Because people included a lot of really good information, including the Walk Boston project.